There's a story playing out all around us, one most of us never notice. It's in the food we eat, the air we breathe, and the jobs we work. It shapes the rules that we live by, quietly and relentlessly, deciding who gets sick, who stays healthy, and who profits from both. Now imagine a force so powerful it doesn't need to campaign or speak. It just persuades. It sells harm as convenience, pollution as progress, and blame as a personal responsibility. And it's so good at what it does that even we start to believe it. In public health, we often talk about the social determinants, the root causes of health. But what if there's something even deeper? The root causes of those root causes. That's what this series is about. Because while corporate interests drive the harm, they also drive the narrative. And yet we're not powerless. Because communities everywhere are showing what happens when people organize, resist, and rewrite the story.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify, so other people like you can benefit from our content.
From PHI Media, I'm Purva Mehta, and with me for this conversation is Dr. Vinu Ilakkuvan, founder and principal consultant of Pop Health and creator of Gaslit, a project taking on corporate influence head-on to advance public health and equity. In this episode, we start off by exploring the career journey of the person working with communities and organizations to tackle these tough questions. So excited to have you here, Vinu. How are you doing?
I am doing well. Thanks so much for having me. I'm excited for this conversation.
Amazing. Us too, to get us started and really understand how you've gotten to where you are right now. We'd love to hear more about your journey. You started in biomedical engineering and economics, which one might say is really not the typical gateway to public health. Where did you end up when the doors at University of Virginia kind of opened up and showed you this world of possibilities?
Absolutely. One of the things I love about public health is that everyone comes to it from such a different place. There's not really a direct path, and it's so interdisciplinary. So you always find those threads of connection to all kinds of different fields. So for me, studying biomedical engineering and economics in college, which it's funny to reflect on this now, but way back when I was in college, long before the pandemic, I had not heard of public health. I did not know such a field existed. And I really stumbled upon it during my college days. And I had at the time really been struggling because I was doing biomedical engineering. I was doing economics because I had a wonderful high school econ teacher who got me really interested in the topic. But I was struggling to figure out what I saw for myself as a career path. I was like, I don't want to be in a lab pipetting things or in front of a computer modeling things. I had done a lot of journalism all through middle and high school and college and loved writing. I loved public speaking. I was like, and I wanted to be interacting with people and talking to people. So I was trying to figure out how do I combine all those things I actually like doing with health and medicine, which I am interested in, and kind of stumbled upon public health. There was a policy internship program at the University of Virginia specifically for engineers, really intended to get folks in engineering thinking about the broader societal and policy implications of their work. So I did that internship, and at the same time kind of randomly heard from someone who was a couple years ahead of me that they were applying to graduate school in public health, and all these sort of light bulbs went off for me of, oh, I think this is what I've been looking for, that bringing together the community piece, the communications piece, the health piece. And so that's really what got me into public health. And then I kept doing internships in the space. And then when I graduated, decided to apply to graduate programs in public health. And that's sort of how it all started.
That's so amazing. And you also completed at Harvard a master's in health communications. Was that after your public health or?
That was my first kind of graduate degree in public health, was this master's with a concentration in health communications. And that really came from my initial interest in public health was specifically in health communications because I had been, again, doing journalism, doing public speaking. So it was really, that's what drew me into public health. But then once I got into that program at Harvard and started taking classes and really got an introduction to social determinants of health and social epidemiology and all these things, it actually really broadened my interest in public health. And I really started to see those common threads between engineering and public health, because engineering is very systems focused, systems level. How do we zoom out and think about how all of these things are interconnected? How do we think about solving problems in a upstream sort of way? And so I really was drawn to that side of public health once I started.
That's amazing. I think we talk about this often in public health, is how important health communication is. It really is the foundation to most healthcare systems. I think it's amazing that that's kind of the first initial step that you took into, but it makes sense. You were so involved in comms and journalism prior to that. So really, this was almost a continuation of your previous journey, not necessarily like a shift of your interest or perspective, but maybe how did that master's in health communications, aside from those similarities that you found, was there a almost new perspective that you gained around public health or health systems during that time?
Yeah, I think the perspective I gained, it really, because my undergraduate degree was not in public health, I really had not gotten that 101 sort of information that people probably now get in an undergraduate degree in public health. I never had that. And so I started this master's program with a focus in health comms, really thinking about gaining those health comm skills. But then what happened was, as I got introduced to the concept of social determinants of health, the idea of going upstream, the idea of changing policies and systems and environments, that's really the perspective shift that happened for me in those 2 years of that program. So that's really what got me into public health for real, not just specifically the comm side of it, but just the public health approach in general.
After Harvard, you really went into the workforce. I think you worked with the state government, with Virginia Department of Health, and then the Truth Initiative, and then the Trust for America's Health. What roles were you doing there, and how do you reflect on how those experiences that you did really developed you as a thinker and a professional in public health?
Yeah, I loved each of those roles for different reasons, but starting at a state health department in Virginia, I feel like, and I tell folks in public health this all the time, I think state and local health departments are where so much of the work is happening on the ground when it comes to public health. And these are also places where, even as an entry-level professional, I really had the opportunity to take on a lot, because state and local health departments are often doing a lot of work for the number of people they have. And that means that every person often has a lot of ownership over the program they're working on, the work they're doing. And at the time, I was managing the bullying and youth violence prevention program at the state health department. And I got to go all around the state to schools and school districts and to share evidence-based prevention information with them, to help them implement evidence-based programming in their schools. And that kind of just boots on the ground experience really opened my eyes both to what's happening in schools, and I still do a lot of work in school mental health. I think it really shaped my understanding of the power of schools as a place where kids spend a lot of time. And it also really helped me recognize, even in a state like Virginia, every community is so different and their experiences are different and the way they're approaching things are different. So I really learned a ton in that work. And then shifting from that to evaluation of the Truth Anti-Smoking campaign, that was really my introduction to corporations and corporate power in public health. And I really got a very in-depth and immediate kind of immersion in how an industry like the tobacco industry not only caused a lot of public health harm, but went to great creative lengths to hide it, to deceive people, to pull on the levers of policy and in philanthropy and all of these things. And so I think that also really shaped the way I looked at all public health issues after that. I feel like I really had my eyes and ears peeled for signs of this kind of corporate influence. And once you start seeing that, you can't unsee it, right? It's everywhere in public health. And so, yeah. And then from there, I went to Trust for America's Health, which really does a lot of policy and communications work at a high level in public health, really thinking across issues. And so that was another thing for me in public health. I really did not like the idea of being siloed in a particular topic or issue because public health is so interconnected and these root causes affect everything. So that's something that I really appreciated about the way Trust for America's Health approaches public health policy.
Out of these three initial roles that you took on, which one would you say really shaped you the most in your thinking as a public health professional?
Yeah, that's such a good question. It's hard to pick one because, as I said, I think they each shaped different aspects of how I think about it. But I will say, as we get into talking about corporate interests and their influence, I do think my work at Truth Initiative, and again, I feel like anyone in the tobacco control field could probably talk for days about all of the stories of what came out when those tobacco industry documents were released through the Master Settlement Agreement, which is when a bunch of attorney generals in the U.S. sued the tobacco companies for essentially defrauding the public and hiding information that they knew. There is so much in those documents about the way in which just the insidiousness and the deception and manipulation. And I think that, again, that really shaped what I noticed in public health in everything that came afterwards.
Yeah, it's almost like you took off these rose-colored glasses and you can never put them back on.
That's right.
I think I completely agree. There's so many, sometimes you'll think about, someone will say, XYZ is an issue. And I'm like, well, that's because of. And it always is the same answer. And I think people get tired of maybe listening to that, but it's just so true. There's always an underlying reason. And we'll talk about this in our next few episodes, like the root causes of this. But going back to your path, somewhere during that time, you decided to pursue a doctorate in public health at George Washington University. What were these factors that really pushed you to go back and learn more, but also specifically do the DRPH versus anything else?
Yeah, absolutely. So I started the DRPH part-time while I was at the Truth Initiative and then continued it. I kind of switched jobs to Trust for America's Health, and that's where I finished. That's where I was when I finished the DRPH. But what prompted me really was this feeling of I wanted to be able to think about and approach public health from a broader vantage point. And again, I was sort of at Truth working on this specific kind of public health issue and topic, but feeling a little bit frustrated that my public health training had really illustrated how interconnected all these issues are, and that when you start thinking about root causes, they really are connected across all of these things. But then often in public health, our work is still siloed. Our state and local health department divisions are still siloed. Funding streams are still siloed. So I really wanted to think about more broadly, how do we reshape the way we approach public health? And it seemed like to understand that better and to take on more leadership in the field, that a higher degree might be helpful on that front. And I specifically wanted a DRPH because I knew even then that academia was not the place for me, that I am so grateful that there are so many people who are so good at what they do in academia and really diving deep into the research. But for me, even in the 2 years of my master's program, I was feeling frustrated because public health is such an applied field. And I was like, I don't want to just be like studying it or writing about it. I want to be doing it. And so I knew for me personally that doing it was where I wanted to go. And so the DRPH is intended to be a applied doctorate degree with a little bit more focus on the practice side, the leadership side. So that's really what I was looking for. And I was working full time in DC. So GW's program, which was in DC and catered to folks who are working full time, really made a lot of sense for me. So that's where I landed.
I think I've heard a lot of people do a DRPH almost part-time alongside a work, like a job or something. Is there an aspect of that? Like, would you find a lot of, like, maybe more fulfillment? Because as you said, you preferred being able to apply stuff. And obviously, a DRPH is already an application-based doctorate. But how did doing your work at Truth Initiative and then going into the Trust for America's Health, how did that really lend itself well to being in school with a doctor, and vice versa too? Like, how did studying and working at the same time really help build your education on that front?
Yeah, I'm really grateful that I was able to do both at the same time, both for the kinds of reasons I think you're alluding to, which is when you're learning something in a classroom setting, kind of having that work context to apply it to in real time is really, really helpful. And I think, this is another thing I often tell people, students in public health, that I feel like I got so much out of the coursework because I had that real world context that was kind of constantly in the back of my head and that I was actively engaged in at the same time. So I think I got a lot more out of courses than I would have otherwise. My dissertation and a lot of my class projects were related to the work I was doing at the time at Truth Initiative. So I was really able to both use what I was learning in class to enhance my work and vice versa, get a deeper understanding of the coursework because it was being applied in a real context. So I really liked having that kind of bidirectional way to build on the practice and the research and the learning that was happening in class. And then, of course, there's just the practical side of, I think for a lot of folks in public health, which, let's admit it, is not the most lucrative field that any of us could have chosen. That's not why we're here. But especially in that context and in a place where a lot of doctorate degrees are not fully funded in public health the way they are in other fields, I think being able to continue working full time just from a practical standpoint made it a lot more feasible to pursue a degree like this.
Yeah, no, totally fair. I think those are all really good points. I know there's people that listen to this podcast that have considered DRPH. I myself might be considering that in the future. So it's great to hear your experience for that. After your DRPH, fast forward to say, I think it was like 2017, you left your institutional roles. And I know they were quite key, obviously, throughout your DRPH and stuff, but you started Pop Health, which is obviously your own consulting practice. But that's a bold move. Like, it's something that I think a lot of people maybe hesitate to do. So I'd love to hear, like, what is, first of all, Pop Health to begin with? Please share that with us. And why did you create it?
Yeah, so Pop Health is a public health consulting practice that partners with community coalitions to drive policy and systems change to transform health in their communities. And I will fully admit that I started it mostly by accident, right? It was sort of a necessity of circumstance at the time. So to kind of paint the picture of where I was at the time, I was, I think, 7.5, 8 months pregnant with my first child when I defended my dissertation proposal. So this was the first stage of getting approval on what my dissertation was going to be about. Defended that, had my oldest and went on maternity leave. At the time, I was working full time at Trust for America's Health. Went on maternity leave, came back, and pretty quickly realized that I was commuting an hour-ish into DC each way, into work 5 days a week. This was pre-pandemic, pre-telework, pre all of those things. And so I was commuting in 5 days a week, coming home, had a little baby, and had a dissertation to write. And I was like, this math is not mathing. I cannot do all these things. Something's got to give. And it ended up being sort of the full-time role at TIFA. And so what I did was talk to them about potentially consulting just for them on a couple of the projects I was at the time actively engaged in, so that I could be home, out of the office, much more part-time, all of those things. So initially my consulting started, at the time I did not have a name or any. Pop Health was not established as an LLC. It did not exist. I just independently was just consulting with them on these couple of projects while I wrote my dissertation and spent a little bit more time with the new baby at home. And once I finished the dissertation and graduated, I kind of had this moment of, do I look for another full-time job? Or I was like, I had sort of started doing this consulting thing, had also at the time started talking to some other potential clients about work I could do for them. So sort of like, maybe I will take this consulting thing for a spin and see what happens. I did not have a business plan. I did not have like a particular focus in mind. It was really just like, I want the flexibility to choose what I work on and when I work on it, and how can I make that happen? And then that just evolved over time. Initially, as with many public health consultants, I just was up for doing anything that I was interested in, right? I didn't have a particular client focus or even topical focus. I was just, if I'm equipped to support on research or writing or what have you, and someone needed it, I was happy to do it. And that's how it started. And then over time, as I got more clients and got more work, there were a couple coalitions I was working with, and I kind of realized that was the work that I was most enjoying. And really, I really wanted to build this consulting practice to bridge this gap that I saw. So when I was at Trust for America's Health, I was doing really 30,000 foot policy work in public health, and I loved how it was not topically siloed. I loved how it was really thinking upstream about policy and systems change. But for me personally, I felt disconnected from the communities where the work was happening, especially having previously worked at a state health department and been out in the community. I was like, we're doing all this work, but it feels so removed from where the real work is happening on the ground in communities. And so that was really when Pop Health evolved to like, okay, I really want Pop Health to be a place where we can bridge this gap, still be focused on policy and systems change, but do it in a way that's really grounded in community. And that's where the partnering with community coalitions really became the primary focus of Pop Health.
That's amazing. What an inspiring story. I think oftentimes we find this to be the case is career paths are never linear. And oftentimes whenever you find yourself like years down the road, somewhere where you never imagined to be.
Right.
That's really amazing. I think it's so great to hear that it's grown into something that's become so meaningful for you. Obviously, after Pop Health, you then started Gaslit, which is a whole new chapter. And from the outside, it feels like Pop Health was about doing the work. And Gaslit is perhaps more focused on naming the system that resists the work that you're doing at Pop Health. So can you tell us more about Gaslit and how is it an extension of yourself and Pop Health?
Yeah, absolutely. And to be clear, Pop Health Pop Health still exists and we're doing our work, and that work continues. So I think of Gaslit as an additional sort of arm, if you will, of this work. And my primary client work is still with community coalitions through Pop Health. It is just that in doing that work, and exactly as you so beautifully put it, in doing the work with community coalitions, I kept seeing where it felt like that work in communities to change policies and systems, that work is often deterred, stopped, pushed back on because of these other forces. And so my question has been, what can we do about these other forces? So the way I think about it is that in the work with community coalitions and public health in general, we're often talking about root causes and thinking about those social determinants. What are those things that are really driving our health? But when we go to change the policies and systems that are related to things like housing, like built environment, like education, why are we often in public health unable to change those policies and systems? And I think it's because of power. And power is something we don't often name explicitly in public health spaces. And I think right now we are in a time where public health and the communities we work with don't have nearly enough power, and corporate interests have a ton of power. And so that's really the imbalance that Gaslit was created to help name and address. And I was really intentional about the full sort of title is Gaslit by Corporations, Ignited by Community. And I think both those pieces are really key. I think we want to name explicitly the role of corporate interests in harming public health and in blaming us for it. But we also want to really explicitly name and focus on what we can do about that, which I think has a lot to do with building community power to push back against corporate power and really to take the lead in advancing health.
Amazing. What a little teaser into our next episode. We're going to go further into really that whole corporate side of it and talking about community and the roles that they play. But before going into that, welcome. We're finally here to the Insight Blitz session, a rapid fire segment. So it's called Insight Blitz. I'm essentially going to be asking you questions, and you'll just provide very brief responses, almost like you're in a hot seat, essentially.
Hot seat, yes.
So let's begin. If you weren't working in public health, what field would you be in instead?
Journalism.
Love it. If you could pick one corporation that you wish more people understood the health impact of, which one would it be?
Go with Facebook.
Oh, interesting. Okay, the public health issue that keeps you up at night is?
Corporate power.
Perfect. I was like, there's so many. How do you pick one? Okay, you're hosting a dinner party with your personal heroes. There are 4 seats. You're in one of them. Who would the other 3 at the table be with you?
I don't know if this is cheating. I'm going to go with types of people.
Sure.
So I'm thinking about community organizers and the civil rights movement. And I don't know if it's Martin Luther King or others that were involved at the time, but that comes to mind. I think about authors. Barbara Kingsolver is a current real-time author whose work I have been really moved by. So I think stories are so powerful. And so the people who create those come to mind. So
I mean, you're one of them. So fits right in. Amazing. Okay, name one myth about corporate responsibility in health that drives you crazy.
I think the CSR, to use your words that you were just talking about, the idea of corporate social responsibility and the idea that corporations are engaging in these efforts to improve society, improve health. I think they put a lot of marketing behind that idea. But when you dig deeper, it is what who wrote this book called Winners Take All about kind of the scam of philanthropy. In this sense, he talks about the idea of like reputational laundering. Like, I think they do a lot of reputational laundering that's intended to make people perceive them as less harmful than they really are. And so yes.
And we could talk about that forever with the social media mascots and stuff.
Right.
Make them likable.
Right.
Oh, yeah, I agree. Wow, I really like the reputational laundering word. I'm going to steal that.
Yeah.
Okay, what's your favorite part about lecturing at GW, George Washington University?
Ooh, I love opening students' eyes to kind of public health approaches and frameworks.
Love that.
Yeah.
Okay, last one. What is the best piece of advice that you didn't follow?
Ooh. It would be something to the effect of, I feel like people often tell you I feel like it's this idea of climbing the ladder, that you should continue to take the next step up in your career when those opportunities arise. And I often think about it. Another piece of advice that I did get and do follow and think about is the alternative of, instead of thinking of it as a ladder, think of your career as like pearls that you're threading on a necklace, and each experience adds some new set of understanding and skill sets, and like together they form something that's bigger than the sum of their parts. But they're not, to your point, they're not linear, they're not a ladder, they're not any of those things. Yeah.
Oh, I love that. And it's also like a pearl is like something new and a treasure that you can continue to actually visualize and learn from constantly. I love that. You've just heard from Vinu Ilakkuvan. Learn more about their career experiences and why she's now committed to partnering with communities to transform health through policy and systems change. Coming up next, we take a deep dive beyond the social determinants of health to better understand what is really pulling the strings in our society. That's next time on the Public Health Insight podcast.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.